All right. Hello, everyone, and welcome to today's conversation, which will explore policy solutions to address systemic racism in education. My name is Alexis Eto, and I'm an attorney and managing director at ChangeLab Solutions, and will be facilitating today's discussion. As I just posted a moment ago in the chat, as we're getting settled in, I invite you all to introduce yourselves. Please share your name, where you're joining us from. We'd also love to know what sector you represent, and if you'd also like to share what brought you to today's conversation. On the next slide here, I just wanted to go over a few quick notes before we get started. So first, this event is being recorded and will be posted on the ChangeLab Solutions website within the next week. You all will also receive a follow-up email with a link to the recording once it's ready. Second, one of our goals for today's session is to create a space for dialogue, for brainstorming, and cross-sector problem solving. The chat function is open, and I see that many of you have already started using that, and we just encourage you to continue to engage with us, think with us, be in conversation with us today. So we invite you to share any reactions you might have, your own experiences and resources, and just use this as an opportunity to engage with each other. If you have any questions that you specifically want to submit to the speakers, please use the Q&A function at the bottom of your screen. We've also received several questions through the registration form, so thank you all for submitting those. And our panelists will be addressing some of those in our discussion today. And if you'd like to join us in live tweeting during this event, we invite you to use the hashtag Uprooting Inequity. Next slide. I also wanted to let everyone know that a live transcription option is available for today's session. In your Zoom window, you should all see a button that says Live Transcript, pictured here on the slide. If you click on that, you'll have the option to either show or hide subtitles. You can also adjust the font size to fit your preference under subtitle settings. And our colleague Bernard Lim is here helping us to ensure that all of the tech runs smoothly today. So thank you, Bernard. If you run into any technical issues, you can send him a direct note via Zoom. Next slide. So for those who might not be familiar with ChangeLab Solutions, we're an interdisciplinary team of lawyers, planners, policy analysts, and other professionals who collaborate with community-based organizations. We also work with local and state governments, as well as anchor institutions such as hospitals and universities across the country to create more just communities through law, policy, and systems change. Our strength at ChangeLab lies in our collaborative and cross-sectoral approach to ensure that the policy solutions are both practical for governments and institutions and meaningful for the communities that they're meant to help, especially those residents that are at the highest risk for poor health. And we do all this through facilitating conversations such as this one, providing trainings and technical assistance, conducting legal research, and developing resources and tools that can be downloaded for free from our website. So today's webinar is the third installment in our 6-part series, Uprooting the Structural Drivers of Health Inequity. Next slide, please. We kicked off the series earlier this month with an overview of the structural drivers of inequity and a discussion of how government, community organizations, and philanthropy are all reimagining their approaches in the context of the pandemic, the economic crisis, and a growing movement for racial justice. Then we discussed equitable enforcement of employment laws. And today we'll be, in many ways, building on those two conversations by exploring the ways in which structural inequities are really built into our education system, and in thinking about how we can retool our laws, our educational policies, and school-based practices and enforcement approaches to really transform that system and move towards a universally shared goal, ensuring our children are safe, that they're supported, and that they have the tools they need to live healthy, thriving lives. Next slide, please. So again, I'm Alexis Eto, and I'll be moderating today's discussion. I'm also joined by my colleague, Cesar de la Vega, who is a senior policy analyst here at ChangeLab Solutions and my close partner on this work, thinking about how we can use the tools of law and policy to create safe, supportive, and just learning environments for children and the broader school community. Cesar will be helping moderate the discussion in the chat and managing questions in the Q&A. We are also so grateful and excited to have such a phenomenal panel of speakers here with us today, who each bring a unique set of experience, of expertise, and leadership at the national, state, and local levels. I'll be handing it over to Ben, Ingrid, Talia, Kristen, and Charlene in a moment to let them introduce themselves. But I first wanted to provide the backdrop for today's conversation. Next slide. To start, I wanted to introduce the 5 fundamental drivers, which are a recurring theme in this webinar series and a framework that is really central to the work at Change Lab. As we know from public health and medical research, there are many factors that influence health, some of which we might not even immediately associate with health at all. And our education system is a really good example of this. Educational attainment is not only itself linked to better health outcomes, but it also leads to better jobs, higher earnings, safer, stable housing, and increased access to healthcare services, all of which are incredibly accurate predictors of lifelong health and even life expectancy. For example, by age 25, individuals with a high school degree can expect to live 11 to 15 years longer than those who do not complete high school. And despite all of the reform efforts, investments, and progress in improving educational outcomes, the wealth and opportunity gap in this country, as well as racial disparities in health, just continue to increase at an alarming rate. These 5 drivers, which are deeply embedded in and perpetuated by our legal system, really play a role in shaping the systems, such as our education system, the environments, the distribution of resources, as well as the opportunities that have created these barriers for good health. So uprooting the structural drivers of health inequity is not only a moral issue, but also a pressing health issue. And this framework offers, I think, a really helpful starting point in starting to identify the various entry points and how to really drive change. We won't be delving into each of the drivers today, and I encourage you to check out our past and upcoming virtual conversations with you. But for purposes of today's conversation, I want to briefly highlight 2 of the drivers which offer key insights for concrete change. Next slide. So the first is structural discrimination, which we'll be referring to a lot today. So I just wanted to provide some quick context setting with the definition. We know that structural discrimination operates as a kind of macro level or overarching driver that influences the other 4 fundamental drivers of health inequity. Structural discrimination operates through policies, through cultural norms, and institutional practices, and occurs when systems, as opposed to individuals, unjustly deny wealth, opportunity, power, or government representation on the basis of characteristics such as race, on gender, ability, sexual orientation, social class, and immigration status. In today's conversation, we'll be unpacking some of the ways that structural discrimination is operating within our public school system and exploring opportunities that we all can take to support and advance anti-racism work that challenges those unjust structures. Next slide. The second driver I wanted to highlight is disparities in opportunity, which occur when some people or groups are denied quality education, denied jobs, and other economic opportunities that would support financial independence, wealth generation, and healthy living. Again, we'll be examining how this plays out in schools, starting as early as preschool, with the goal of identifying some of the concrete action steps that we as public health advocates, as educators and administrators, healthcare professionals, government officials, parents, and citizens, what we all can do to ensure that our children and babies are safe, that they're healthy, and have a fair chance to live a thriving life. And to that point, I also want to just acknowledge who's not in the virtual room today, specifically the students who are really the ones most impacted by the structures and policies we're discussing today. And we're grateful to have such an amazing group of speakers, many of whom directly work with children and families, and will be elevating some of their experiences and conversations today. And of course, if there are any students or young leaders in the audience, I encourage you to share your thoughts and reactions and experiences with us as well in the chat today. So with that, I'd like to now invite each of our speakers to briefly introduce themselves, share a little bit about their organization or affiliation, and perhaps just some brief reflections on the perspective that they're bringing to the discussion today. So with that, I'll just open it up for whoever is ready to jump in.
So I'll get started as we're all trying to be so kind so we don't jump over each other. I'm Charlene Russell Tucker, and I'm currently serving as the Acting Commissioner of Education here in Connecticut. And as by way of background, I've been in the agency for a while. I won't say how many years, but over that time that I've served in different roles. I was a bureau chief, I was associate commissioner, was deputy commissioner, and finally now in this role. And what's really important in that role is that the entire time, as I was listening to you, Alexis, I've overseen health-related initiatives of the agency and addressing non-academic barriers to learning. So it was about student support. So issues of attendance and discipline and all of those things that we talk about today, with health as a major core. And so certainly the intersection of health and education is what I like to think is a sweet spot, because they truly are aligned. So I am thrilled to be here today with just an esteemed panel and look forward to the conversation that we'll be having together. So thank you.
So I guess I can go next.
Oh, go ahead.
Okay, sorry, good. My name is Ben Cairns. I'm currently the principal of Lake County High School, a small rural high school in Colorado. But my background in restorative justice started in Uganda. I worked in Uganda from 2003 to 2006 and learned about restorative justice kind of from indigenous kind of peace workers in Uganda, and really worked on thinking about how to translate it into schools, and how to take these sort of beautiful restorative practices that people had in their communities, but were not part of an education system that was very Western, a very Western education system. They used this, kind of disciplinary, exclusionary measures we use in our Western education system. Got lucky enough to then, help develop the restorative justice program in Denver over many years. Got to work on some of the state policy in Colorado as well around restorative justice, and somehow found myself as a school administrator. And I'm now currently a principal. My favorite job I've ever had is working just straight in restorative justice with kids and families. The one thing I would say that has always been part of the Denver story, I think is really important for today's conversation, is that, Padres and Jóvenes Unidos was a community-based organization in Denver that really was, looking for solutions to racial disparities in school discipline. And so they really looked to restorative justice as one way of addressing those disparities. And so in Colorado, the RJ conversation and, racial inequities in school have always sort of been connected and linked, which I think is lucky, because I think for Colorado, we're very grateful to Padres y Jóvenes and their sort of push to keep that the focus, because there are RJ programs across the country where racial justice is not a focus, and restorative justice can perpetuate inequity in many ways. So that's kind of who I am. I think the perspective I bring is a person who's working in a school right now, thinking about restorative justice. And I think my niche in this conversation and in this world often is like, how do you actually make it happen in a school? So I'll probably get interrupted while I'm sitting here as kids come and bang on the door and ask me for help with things. So thanks so much. Super humbled to be here. A lot of smart people on this panel. I'm really grateful.
So I can go next. Good afternoon. My name is good afternoon. Good morning. I'll say good afternoon from Connecticut. My name is Ingrid Kennedy. I am the executive director with the State Education Resource Center, SERC. We are a quasi-public entity that is uniquely positioned in Connecticut by legislation to support the State Board of Education, therefore the commissioner and active commissioner of education in the state, with their programs and services regarding equity and excellence in education. We have been an organization that has been one of the professional development arms of the State Department of Education since 1969. And I'm just an honor and pleasure to be here today, especially when I take a look at the drivers. When we're talking about structural discrimination, when we talk about disparities, our organization has been spotlighting how that impact of discriminatory practices has really deteriorated many of our communities. So talking about discrimination, structural discrimination is important at all levels for us. And that's what we have been doing for over years, not just about a race, We talk about gender, abilities, disabilities. So we want to make sure that today, through this conversation, the perspective that I bring is the collaboration that happens at the legislative level, the collaboration that happens at the systemic level, and how, when that happens, we can actually dismantle systems of oppression. It can only happen if we do it together. And we realize that those discriminations do exist. So we need to acknowledge it at all levels. So it's definitely an honor to be in the presence of this amazing group of panelists. And I'm looking forward to learning from all of you as well as from the audience. Thank you so much. And thank you for the invitation.
I'll jump in next. This is Kristen Harper. I am Director of Policy and Outreach for Child Trends. We are a research institute devoted exclusively to children, youth, and families. I've been at Child Trends for 4 years, and before that, I spent 7 years at the U.S. Department of Education. My work has really been at sort of the intersections of education and health, education and justice, and I wear 2 hats in this work. I wear a policy hat, and I'm always thinking about how do we leverage law and policy to help advance the goal of equity, be it the Elementary and Secondary Education Act, be it the Individuals with Disability Education Act, be it Medicaid. But also always thinking about how do we ensure that policy and policy implementation always aligns with the best available data and research. So excited to join this afternoon's panel. I'm joining you from Maryland, so this afternoon's panel, and looking forward to the conversation.
Hi, I'm Talia Gonzalez. I'm right now in LA, so I'm still in the good morning category, but not much longer. So I hold 2 positions. One is a professor at Occidental College in the political science department. And then the other is actually a research position at Georgetown Law School in the Center on Poverty and Inequality. And so coming to this conversation, one, I've actually been connected with several of the other panelists over a few years, and some of our hidden non-panelists, but folks from Change Lab providing support. So, I have, from an empirical standpoint as a researcher, spent time and actually first met Ben back in, and I will date us a little bit now, Ben, 2008, when Denver Public Schools was really emerging and engaging in its work, and in particular when Ben was a practitioner at North High School, and spent time evaluating what that work looked like, both as it arose from a community standpoint, but then how it was being operationalized and used and really embedded within the school community to think about addressing racial disparities. What I will say from the Denver story and the commonality with Denver and other places is that there still continues to be the missing link about what this means for health, right? And so what is the relationship that we understand between structural discrimination and racial disparities in school discipline and school policing? So I look at both racialized sets of practices and policies, and how we might understand that either empirically, theoretically, from policy change and from in terms of legal reform, because of the association with health beyond just academic achievement outcomes or other related outcomes that we see most saliently in the health conversation. So a lot of the work that I've done then with Alexis and Caesar since 2016, and also my empirical work at Georgetown, is really asking the question of how do we really start to unpack the conversations, but more importantly, have toolkits where we can connect the dots between school discipline policies and practices and what health outcomes and inequalities look like for students across a whole range of identity markers and understandings. But then more importantly, what are the ways that we can either leverage existing laws and policies or engage in systematic reform of those? Or from an academic side, what does teaching look like? So how do we reform our curriculum, and how do we think about what our teaching practices are and those opportunities? And then, thinking about the work at Georgetown, we actually next month, and this is that moment of I'm actually really excited, we're releasing a 2-year study that specifically looked at the experiences of Black and Latina girls with restorative practices as health protective factors. So it's, again, how are we really asking these questions that when we're uprooting structural disparities and these drivers, and then thinking about individual and population outcomes, what are the possibilities and where do we have gaps in knowledge that we want to keep pushing forward? And I really echo Kristen's point and Ingrid's point in thinking about that from an intersectional perspective, because we know that there are just differences in lived experiences, and who you are walking into the classroom and what those perceptions are of you, but then also where you've come from in your lived experiences. So I'm really looking forward to today's conversation and how we can sort of engage in a whole host of both problematizing, but most importantly, as Grace Lee Boggs would suggest, solutions. So being the revolutionary solutionaries in that context as well.
Thank you all so much. It's just thrilled to be in conversation with you all today. So let's go ahead and dive in. I think to do so, I wanted to start by just grounding us in the history of the public education system, which forms, the foundation for how our schools operate today. And Talia, I think sticking with you, I'm hoping to ask you this first question, and I recognize that we could probably spend the entire webinar, if not more, discussing it, but I wonder if you could provide just some brief context setting around the history and perpetuation of social control, around structural discrimination and the inequities that are deeply rooted in our education systems and policies.
Sure. And you're right. It could be an entire day, an entire week, an entire movement, a lifetime. But that being said, to I think your more specific call of the question, when we think about racialized school policies, and in this context, I am using racialized because we really are coming from a foundation of slavery, social control, racism, anti-Blackness, and also settler colonialism, and sort of acknowledging that those really have formed the foundation and backdrop for what, when we talk about our current school discipline policies and policing practices, and then how they're embedded within state and federal law, that's the foundation. So there's ample historical evidence that shows, as our educational system was developing, that white decision makers were very clear that slaves had no place in what was the privileged and high regarded school spaces. And so what that meant was that even in a backdrop of, the passage of the 13th Amendment or movement against corporal punishment in the late and mid 1800s, there was this very strong and clear focus on how do we create a law and order framework. So that meant that students who were from lower backgrounds or from racialized backgrounds that were non-white were deemed incorrigible. The use of corporal punishment was acceptable to repress those individuals from wrongdoing. And in fact, when schools had to take students, or some of the text reads about they were scooping up students from diverse backgrounds, that they were going to contaminate other students because of vicious parental examples or, vile associates, right? This language that's really being characterized about who those students are that we see continued into our current day language when we're thinking about the use of incorrigibility or other ways in which we define student behavior. And so it was really about perpetuating the captivity of Black students and Black people and ensuring that there was surveillance. And so that meant that, to your point, right, there became this norm in education. We had a law and order approach that was what marked classrooms, that was put into law, both at the state and the federal levels, and was the basis for really deepening structural discrimination. But as then we're all thinking today about health inequalities. So, we can fast forward even to times of integration post-Brown, where politicians and academics, right, let's be clear, with that level of complicity, we're diagnosing, socioeconomic inequality, rising poverty rates, or even uprisings within urban communities, as then we needed to have law and order because they were being caused by those residents, not by the discriminatory systems. And in fact, very often what we would see then is white communities arguing that desegregation couldn't happen quickly because there would be a lack of discipline among Black students that were coming into their white schools. So again, that constant narrative about control and the ways in which we respond to that. And then for those of you in the room who are familiar with this, I apologize, but I do want folks to think about when we started putting police in schools to operationalize this norm and these policies and these practices. That was in the early 60s. So across the country, we started putting armed and unarmed police officers in schools. And simultaneously, we started passing state level policies and laws that gave a lot of deference and authority to teachers, administrators, and law enforcement. And this was actually that time where we had the designation of pre-delinquent. that was coming out of the 1974 Juvenile Delinquency and Prevention Act, which is really the origins of our school to prison pipeline, because you could now label a student in that pre-delinquent category and have the policies or practices then be used against them or operationalized in that way. And so that's where there was this reinforced message. And again, it wasn't just happening in schools locally, it was happening at the federal level. You had the Gun-Free Schools Act that was passed in 1994, which actually is the model that led to most of our punitive and exclusionary school discipline laws and zero tolerance laws in schools. And so now, I think what we're grappling with, and we see this in our contemporary moment in this social pandemic, which is, how are we imagining what school police look like? Why should we care about what school policing is beyond just the basic level of violence? And then where does school discipline land? And I'll end on maybe something that's more positive for you, Alexis, and for this conversation, which is, across the country, 32 states have reformed their punitive discipline laws. And so there's movement towards that. And obviously there is this current movement towards thinking about either divesting from school police or reinvesting funds or sort of shifting the ways in which we construct that. So really countering that early and deeply embedded narrative about social control. But there's certainly a lot of work to do. So I think about, with Ben's work in restorative justice, there is an intersection between restorative justice laws and exclusionary school discipline laws at this point, where the number of exclusionary school discipline laws still are about double the number of restorative justice laws in the country. And that even to the extent when we do have restrictions on the use of punitive discipline, it's typically for kids and for students grade 5 and below. And there's only actually been 2 jurisdictions. Connecticut wasn't intentional, to do a shout out for y'all, and the District of Columbia that include middle and high school students. And unfortunately, none of those laws, and when we look at the legislative history, talk about health. And so again, there's this great opportunity for us to really invigorate this conversation and bring a whole host of different opportunities to asking and answering, I think, this legacy question. I hope that helps, Alexis. And in as narrow as I could get as an academic, I'm sorry.
It's probably an unfair ask to cover all of that in, 2 minutes? But thank you for, I think, uplifting both the real challenges that we're struggling with, but also some of the opportunities and already some of the concrete policy solutions and opportunities that we've already seen take hold across the country. I also wanted to just note that I think understanding that history and, that structural discrimination is really baked into our very school system, in some ways very, discreetly, in other ways very overtly, that it just goes to illustrate that the foundation in which our system is built is very problematic. It's broken. And I think that piece has to be part of the conversation when we're thinking about what change looks like. And I wanted to pass it to Charlene and Ingrid, because I think when we're thinking about these conversations, and I think recognizing that the topic of race can be an emotionally charged conversation, it can lead to, on the one hand, defensiveness and walls going up, and on the other hand, it can be a painful to process and even re-traumatizing. How do you have those conversations, I guess, in a safe and supportive way? And I guess this is a 2-part question. And how do those conversations then lead to changes in practice?
So Alexis, thank you for that. And Thalia, thank you for kind of setting that context. And I didn't say this in the introduction, but working with CERC through Ingrid Kennedy's leadership has been just absolutely awesome for many years. And so the conversations that we're having today is a conversation that we've been having for a decade. And not just conversation, but really thinking about what are the drivers for change. And to the point, Alexis, how do we have these conversations? And so where we are today, seeing results really started a while ago. From the state agency perspective, we've been disaggregating data, right? Assessment data for a long time, because we really wanted to make sure we could have a conversation about the difference, the disproportionalities we were seeing. So we really could have that conversation, not just at the state level, but also at the district level. And so that really where it is, really data informed. The same is true for our discipline data that we've been disaggregating do it since 2008 or so, that we've been very transparently having these conversations about what our data looks like and the disproportionality there. So we could start from a place of let's have this conversation based on data. We know we all get really emotionally charged about it, but let's sit back and let's look at the data. What is it telling us? And what are some root causes? And so, you mentioned earlier about student voice not in the room, and we make sure really it takes the entire community to have this conversation if we're talking about change. So, we're families in the conversation, they're in the room with us. We're the student voice, they're in the room with us. We're educators in that same room. We're the lawyers, we're the school attorneys in that same room. We're higher education in that room. So we try to cast a very wide net to have these courageous conversations together. And I'm going to share with you a quote from a student why this is so important. So I'll bring that voice in the room. With COVID, wanting to talk to our students, we launched a thought exchange, which is a crowdsourcing platform. And the first one we did, we had about 16,000 students who we know were in so many cases were in a front row seat to everything that's going on around them. We're thrilled that as of today in Connecticut, that educators work so hard that 100% of our districts are now offered some in-person learning for students. So shout out to them and really thrilled about that. But in this thought exchange, the students said, we're all experiencing one trauma together. And instead of just forcing us through it, talk about it with openness so that many students are struggling and so few are saying things. Have people checking on them, have someone reach out to them. A lot of students need it. This is the voice of the students that we have to have these conversations openly. We need to do this together. So how do we help our educators to have those conversations? I think that's the point that you were making earlier. And so to the point of being solution focused, that's the driver for us. How do we get everybody in that same space so we can have these conversations together and then talk about real life solutions for our students? And so I'm going to pause there because I can share with you what we've done at the state agency level with CERC support, but Ingrid also has those conversations directly with educators and students as well. And then we're in the same space together. So Ingrid, I'll turn this over to you to kind of add some further context to that.
Thank you so much, Charlene. And I'm actually going to frame my comments built on what Dr. Gonzalez mentioned about the fact that the history that we need to recognize, we need to be very aware that the discrimination existed and where it came from. And to connect it to Charlene, the technical aspect of this conversation is about the data, understanding of the urgency of the moment, or why do we need to find solutions together. The other piece about this is the adapted conversation, that I'm going to link that to the health component. If we do not understand the history and the disparities that exist, this thing that we call anti-racism and anti-oppression, if we do not acknowledge that we need to find solutions together, erodes the soul. This is the social emotional piece. When many of our students feel in our communities, their identity has been denied and how their identity is portrayed by the media. And we can go on and on with this, but I think the piece about it is in order to be able to engage in this intentional solution to achieve results as it relates to this mental oppression is that we need to recognize that we need to start with self. This is the piece about where do I stand as an individual regarding the urgency and understanding the history. In order to be able to do that, we need to understand that as individuals, we have our own biases. And it is the racist action is when we act on those biases. So if we recognize them and we engage in a place of safe space of conversation, understanding that each one of us is coming into the space with our own agenda for the betterment of our children, our students, our communities, then we open the door for those conversations. So that's what we have done in Connecticut, as Charlene has mentioned, for decades. Almost, when I'm thinking about, we started regarding looking at the data, but then we realized that the data was not just numbers. The data were students. And the students have a racial identity. Our students with disabilities, our students that are being identified, and we needed to isolate that from the conversation. We needed to talk about who they were first and how the history, as it was mentioned earlier, got them to that place. And we needed to recognize that. So that's what is so important, to engage in these conversations that will lead to action, but it starts with self-reflection. Where do I stand? And do I believe that there is an urgency in order to be able to create change? So I will pause there because I can go on and on and on. And I know that we only have a limited amount of time. So thank you for the opportunity. Hopefully come back in a few more minutes. Thank you.
I think before moving on to the next question, I was just curious to ask Ben if you have any thoughts, or if you could just share some of your experiences working in schools and kind of like what comes up for you. What conversations are you having with your students?
Yeah, I mean, I think actually what Ingrid said is so important about data. I mean, I often joke with folks that like data is not about understanding math, it's about understanding your own feelings and your defensive feelings that will come up when you look at data. And I think what, Talia, giving the context is so important, because I think in schools we see these outcomes, right? Like we oversee these outcomes, teachers, principals, and we're not happy with them, but yet they continue, right? And so understanding this history of like how we got to where we are, and then understand the data and being willing to like look at the data and respond to it. Because I think, the human being's initial response is to say like, no, there's got to be some other explanation. I have racialized data in my school discipline or my referral law enforcement, and it's some other explanation other than me, or other than, my school. And so I think it's really important, what Ingrid was saying, to be able to help your staff, help your students to be open to like accepting it and then moving forward with what it is. I mean, kids get this, right? Like kids actually know all the stuff we're talking about. Kids know school is unfair. They know society is unfair. And we say stuff like, no, it's not. Just, get that 4.0 and you'll be fine. And kids know that's not true, right? And kids understand that. So when kids tell us that, and we in education don't want to listen to that because we're so invested in what we're doing. Like, no. If you pass this history test, it really will. Life will turn out okay for you. So kids know this, and I think it's important to really talk to kids and to be reflective about how we can change our educational systems to deal with the reality of what kids are facing in our society, in our communities. I guess the last piece of it that I would add is, I think people have spoken to this, is do kids see themselves in school, right? Do kids see their journey and their success and their long-term health outcomes, right? Do they see school being a part of that story for them? Or do they see school as just one more extension of a system bent on messing with them? And I think far too often kids see school as just another extension of some system meant to mess with them, and not some path to helping them fulfill long-term happy outcomes for health and life. And so I think discipline is certainly a big piece of that, how we do discipline, but it's so much deeper than that, right? It goes so much further beyond that. And so I think educators being just reflective, I think, is the first step, and being continually reflective. I feel like I've been in this work now for a really long time, and man, just constantly humbling to realize how you, even against your best sort of ideals, don't meet your goals with kids on a day in, day out basis. And being willing to try to change when that happens.
And just to add on that, I think you're really touching on the importance of relationships, and teaching and learning really boils down to those relationships. And that's something that I know teachers and administrators know firsthand. But also now we have neuroscientists and public health institutions like CDC also kind of reinforcing that and pointing to just the power of connectedness as, the most important protective factor when it comes to protecting students from a whole host of, adversity and the adverse impacts of childhood trauma. So I think that is a key piece when we're thinking about what change and what policies might look like, is how do we create those safe and supportive spaces for meaningful connections. And I I think that actually segues maybe into talking about too, like the current reality that we're living in, and thinking about how challenging it is, particularly in creating those safe and supportive spaces in the context of COVID-19, which has created even greater inequities in an already broken and unjust system. And educators, school leaders, students, and families are all just dealing with a lot right now. So I was wondering, I can just open this up to everyone, but just to share kind of what are some of those pressing issues, and where do the opportunities lie in that intersection between education and health, and in thinking about how to create safe and supportive spaces in this kind of current context where we have a mix of virtual, remote learning still, hybrid learning, and now also kind of reopening schools and having in-person learning.
Alexis, I'm happy to jump in, but I do want to quickly ask earlier, I think my sound was staticky. Am I coming through clearly now? Awesome. I just wanted to add to the conversation just the need to think about equity as it relates to special education as well, to think about the experiences of children of color. But as we're thinking about improving equity, racial equity in education, and improving access to health services, and in supporting wellness for these children, thinking about race and disability together. And special education is an important part of that equation. Right now, we know that Black children are 40% more likely than all other racial and ethnic groups to receive special education services. They're twice as likely to be identified with emotional disturbance. But I think I'm going to follow Ingrid's example in distinguishing the technical challenge here from the adaptive. The technical challenge here is, again, in the data, the practices and procedures that result in a numerical overrepresentation within special ed for children of color. And the adaptive challenge we face is our resistance to inclusion, an ongoing collective instinct to segregate. And in this instance, facing the adaptive challenge would mean facing history, the reality that special education is both a critical source of support to children with disabilities, and it was also a mechanism to maintain segregated education programming amid efforts to racially integrate schools. When we look at discipline, for example, the reality that we have to look at race and disability together is, cannot be clearer. Generally, when we're looking at rates of, school discipline across the nation, you generally see a rate's about 5%, but in any given year, 5% of children are removed from schools. If you look at children with disabilities specifically, that number more than doubles. You're usually talking about rates anywhere from 10 to 12%. When you're talking about Black children with disabilities, particularly Black males, the number doubles again. We're now talking about a quarter of Black males with disabilities are experiencing out-of-school suspension in an individual year. And that is even with all of the promises and guarantees that IDEA is supposed to offer children with disabilities. So equity in this, for racial equity, has to integrate within it, an effort to look at these intersecting identities, but also this, aspect of our education system that doesn't always make it into, conversations like this, and that is special education and the promise and the failings of IDEA.
And Kristen, I'll jump into that because as well as you're looking at the data, and I talk a lot about the data because it does drive our actions and create, as Ingrid said, that sense of urgency. And it's so interesting. We stood up a new data system with COVID, folks getting back in school, because we wanted to know very much kind of in real time every week what was the learning model being offered, because not, some folks were doing a hybrid, some were, fully in. And we know families, we gave them an option in Connecticut, or school districts offered an option, a voluntary option of learning fully remote. And we checked to see what that looked like also in terms of the data. And we recognize that families, for reasons that we can think about when you connect it back to health, multi-generational homes, concerned about the pandemics, concerned about the virus, were selecting remote options. And very early on, we also had the digital divide, right? Folks did not have devices, did not have connectivity. And so you can see the ripple effect of all of that. But we've been able to take a look at the data to see what's the percentage of our students who were fully remote by student group. And so we looked at English learners, and we looked at students with disabilities. We looked at our students experiencing homelessness. The same thing for those students, their attendance during remote or in-person days. What does that look like? And are there disproportionality? And we looked at those who were chronically absent on a monthly basis, just to see what's happening, that it could inform not just this agency's support of districts, but the state's response, right? Because as we think about COVID, right, it's really about what happened economically, what was happening through testing, and what's happening around vaccinating, all those kinds of things. It was necessary that education was one piece of a larger picture. Our governor a couple of weeks ago launched, based on the data, a program, a learner re-engagement, basically program, using $10 million of funding into the state. We've also, as a state agency, education made priorities around health and priorities around social emotional learning for utilizing the funds that's coming into the state. So it's really so critical to put all these pieces together and to recognize the solution is really multifaceted, and we need to provide that support. And so I speak from the state level, right? What is it that we need to do there to signal the importance of making sure that we're addressing the whole child, the whole student, and using what we're learning from the data to help support and drive the work that we're doing. And so just really wanted to add on to that. So critically important to have that information available to drive the actions that we're doing. And it's a different conversation when you can bring, you go to a district and let's look at your data. Let's start there, right? So a little bit hard to deny, and then talk about, what we need to do in relationship to that.
I think something that's coming to mind for me, and a big piece of this conversation too, is I think about the distress that many families, particularly families of color, experience when it comes to, going back to in-person learning because of that structural discrimination that we've touched on and the way that it plays out in policies and practices in schools. And I also know that there are, and I know Ingrid and Ben, you can speak to this more closely, but the challenges around re-engaging and getting students back into school. So I can pose this to the whole group, but I would love to hear kind of your thoughts on how do we address that distrust, mistrust, and how do we create those safer, more inclusive environments that allow kids and families to have more trust in schools.
I mean, Alexis, that's a super big question, but I don't think I can pretend to answer quickly here. I think there's two things that I'm thinking about. And first of all, I should say, as I'm listening to this conversation, I've noted down 10 things I want to do better in my building, just today, including with the questions coming in. But I think two things that I think a lot about with re-engagement. One is you have to create a structure for relationships, right? You have to have, and schools, are all different shapes and sizes, but you have to create a way for kids to connect to adults in the building. And you have to do it in a way that it's built into the structure of your school. It can't be an add-on. We often hear about the invisible tax, on African American and Latinx educators, where they're sort of tasked with building relationships with all the kids. It can't be like that. It has to actually be built into the system where all your teachers are connecting with kids, and everyone has a way to do that. So we do have a half hour of our day set aside for something we call crew, which is just relationship, connection type of thing. And during the pandemic, that has absolutely saved us. When this first started, we had crew. And so I knew every teacher had 16 kids that they were sort of accountable for. And so when the pandemic started, and I heard a school saying, okay, math teacher, contact the 35 kids in your fifth period and see what they're up to. Like, that's insane. There's no way that worked. And so what we were able to say, hey, crew teacher, contact the 16 kids they're your kids, and their parents, and you've been meeting them for a couple of years, you know who they are. And I'd say within a month, we had everyone hooked up with the internet, and we haven't lost anyone during the pandemic because of that. I don't think we're all that smart or anything, but I think it's just some kind of relationship building structure has to be part of the day. And then I think the other thing that we do to create this space is restorative justice. When things go sideways, which they will, restorative justice is our approach, right? So I had the situation, just I'm dealing with it right now. I'm listening to it on the radio, where a kid and a teacher had a disagreement, didn't get along, and they're now, the team is figuring out a time for them to sit down together and talk about it. And in the restorative justice process, when it works authentically, the kid has a voice, teacher has a voice, they hear from each other, and they build that relationship. And that, in some ways, I think sounds like really trite compared to some of the things we're talking about right now. But it's also, I think, a fundamental value that is incredibly important. And if you want kids to feel connected, when stuff goes sideways, they have to get a chance to reconnect with their teachers. And you have to rebuild a relationship, and you can't just move on and pretend like it's going to be okay. It won't. They have to sit down and connect. So those are two super simple things that we do. I won't even pretend to act like they're solving these giant challenges we're talking about, but I think they're incredibly important starting points, and they're doable in a school. Any school in America could do them tomorrow.
Alexis, I would also like to add that one of the things that we have done in Connecticut, and this is again in collaboration with our partners at the State Department of Education, is actually a series of Let's Talk sessions with our family. But the interesting thing that it has taken place is not just the families attending this Let's Talk series, these sessions, and we engage in conversations with the families, and educators, administrators are participating, and they are facilitated, and we have specialists from the fields to engage in Q&A with the families. But what has taken place is that the reality, COVID-19 has brought in a different level of partnership between home and school. When the students link into this virtual space, the teachers are coming to the house. If you think about it, they are coming in, and now we have some of the families asking questions about how can I ensure that my son or daughter is keeping up with the work. And then the teachers asking the questions about how do we make sure that they are connected or that they are getting the right information. So what it has taken place is through these conversations is a higher level of interaction that is taking place between the family, school, community partnerships, and they are just flourishing in some cases. The other piece that we are hearing is going back to the social emotional piece of the families. The concern that they have about how do they make sure that their son and daughter is being successful? How do they become a great parent during this stressful time for everyone? And how to ensure that they taking care not only of themselves, but everything else that is happening around them. We have a doctor as one of the facilitators in the conversation, and he mentioned it this way, and in that vision is stayed with me. It's like, this pandemic has put almost like a loose lion in the house, and everybody's trying to control this lion that is loose in the house. And it's like, and we're trying to also try to go after it at the same time. And we haven't been able to pause because it's just taking so many things away from us. So what he recommended, and I loved it, it was, let's pack a party in a bag. Just pause for a second for the families and the educators. Pause for a second, get the bag and get the tambourine out and celebrate something at that moment. The fact that we're connected, the fact that we're with the teacher, the fact that I'm able to speak with the educator, with the student. And that was so important for the families that develop a next level. So to Ben's point, communication, relationship building, And that's what we're experiencing right now through some of these sessions. And we hear it from the educators and from the families as well, is to be able to establish that relationship. And that relationship to also align with the concerns that the families have about sending their son or daughter back to school. So having that communication with the administrators, with the teachers, in order to be able to build that level of safety and comfort as the transition begins to take place.
And I'll add, and I see your hand up, so I'm going to jump in here, because if folks are participating who are members of state agencies, that's the perfect example of a partnership with the state agency. When we decided here that we needed to support not just our educators, but the whole school community. And, that's another webinar. We can talk about how we've done that, but supporting families directly as a state agency was really important to us. And so that partnership with CERC to say, bring in, frankly, before we got back to school, we had a house call. We had I guess about 1,000 families. We said, don't talk to us, the education bureaucrats. Let's talk to the experts. We're going to get doctors and pediatricians in the room, and you talk to them. You ask them questions about what we should be thinking about to go to school safely. And so now we're thinking their own social emotional well-being, just understanding what's synchronous learning, what's, all of those kinds of new jargon. What does that really mean? We're bringing them together to say, let's talk, let's learn. And it is building a trusting relationship, and hopefully one that will go back to that other question of how do you, break down the silos and develop trust to come back into the building. And we're working with our districts on that, working directly with families on that. And the program I just talked about, the Learner Engagement Program, is actually having folks deployed in the community who are cultural brokers, who can join with district staff, literally if they need to go knock on doors and say, number one, where are you? Or what do you need? And how can we support you? And that is the approach that we're taking on here, because frankly, and then we've connected that with resources that we've put out just recently on summer learning and enrichment, to be able to say to families, and here are the places and the spaces that you can go. It's for fun and learning this summer. So I speak about it from the state. What can the state do as a lever and connect with locals around this? Because everybody's got to be in this together. That is how important it is. And that, to me, is what it's going to take for success.
I mean, Charlene used a word that we're not using enough these days in schools after the pandemic, which is fun, right? And I do think school's not fun right now. Sitting at your computer is not fun right now. Wearing your mask, getting told 100 times to step away from your friend and don't touch your friend is not fun. And so I do think that one of the things we're talking a lot about next year is how do we really make school fun as part of what we're doing. And I think the notion of school being fun is something we've really lost in this whole ed reform conversation. And this focus on learning loss has the real potential to further make kids hate school and see themselves less and less in school. So I love hearing Commissioner of Ed talk about fun. I wonder if that should be kind of like a part of the renewal of the next federal laws around education is fun for children.
There's going to be the fun component. So I'm going to take this conversation in a slightly different and perhaps not as exciting space. And then I think we've heard some reflections on best practices and ways in which things are going well. I guess I want to really intentionally remind everyone in this space that punitive and exclusionary school discipline still exists. And that even though we're in a virtual context, those practices have persisted. And in fact, by moving school into the home, it's put kids, especially those with intersectional identities, at increased risk. And so I'll reflect a little bit on some work that I've been doing with colleagues in the Philadelphia area schools, which include both charter schools and neighborhood schools, to bring this home where perhaps they haven't learned the best lessons from Connecticut or from Colorado, which is, right now, without due process, there's informal and untracked digital discipline. So kids being put in Zoom detention, kids being put in isolated breakout rooms, either individual children or cohorts. Students are muted. They're made invisible. They're being denied entry into a synchronous lesson. They're being denied entry into class if they're not on video. And then those are counted as absences. And then that becomes truancy. And for students that are living in congregate shelter care settings, for example, they're being prohibited from fully participating and kept on mute because the background is too loud. And if they're on mute and they're not participating, then they're not counted as being present in class, which is then an issue again for truancy. There's been examples where the Department of Health Services have been called when this was when it was really difficult to talk with my colleague, when a parent was seen dancing in the background, that the school reported educational neglect on the basis of this. There was another call that was made when a student's parent was sleeping in the background on camera because school is in the home now. So we're making a whole set of judgments about what a home situation looks like when we are all at home right now. This is as Alexis and Caesar knows, this is one of the first weeks that my daughter has been back in school. And so to the extent like she's not popping in and waving at everybody is like an incredible luxury that I'm experiencing with her being back in preschool. But if, we just need to be really clear about what that means when we're talking about these racialized policies and these policies that are then disproportionately impacting students, not just because of racial identity, but because of a whole host of intersectional identities, and what that can look like, that they haven't gone away now that we've moved virtually. And in fact, there's all kinds of hidden ways in which they're existing. And then we couple that with the fact that when you're in someone's home, the biases, both explicit and implicit, are rearing their ugly heads in ways that decision makers and teachers in particular that have that authority and are stretched thin to recognize so clearly that comment, right? That the mental health and health needs are not just exclusively lying with students or with their families, but this is becoming really problematic. Again, in Philadelphia, we're seeing multiple reports of students being disciplined for wearing their pajamas or being excluded because they're not in appropriate athletic attire for PE. Unfortunately, there was a high school student that was threatened with involuntary psychiatric evaluation for laughing and appearing joyful, and that was a Black student. And so, it's just, let's be clear that there are places where there's incredible work that's being done, but there's also places, again, to Alexis's point, where do we see the potential of COVID exacerbating what we already know about school discipline, the way that it produces PTSD symptomology, the way that it exacerbates risk factors for disassociation and push out from school and everything that sort of pushes us further along that way and those collateral consequences in this virtual environment. And that doesn't mean that we can't now pivot to thinking about what are positive solutions and ways that we can now collaboratively approach that, but it's not uniform across the country. And so I think from our aim as a group of people gathered as 235 interested in this topic, if we're going to uproot these, one of these structural drivers, to be really clear about what our contemporary environment looks like, not just what our historic of like 2019 looks like as well. So
just to add to that, Talia, discipline is probably, as schools reopen, is also going to be fraught. I think we can expect that. And as schools and districts are trying to figure out how to prepare, we've not seen like a strong voice from states in helping to guide responses to student behavior as part of reopening plans. Looking this fall when Child Trends was doing a lot of tracking of health in school reopening plans, discipline was just nowhere. It really wasn't anywhere to be found. I think we found 5 states: Texas, Ohio, Connecticut, Hawaii, Vermont, that had published something that specifically spoke to how schools should think about discipline or prepare, for discipline practice, prepare prevention options, going into the school year. A study published recently that said that as of February this year, anywhere from 37,000 to 43,000 children have lost at least one parent to COVID. That is a 20% increase over what we would generally see in any given year. So when we're talking about discipline we're taught, we really do have to think about trauma, and we have to think about this whole new range of behaviors that we're asking kids to not engage in. From we want them to make sure they wear their mask. I've seen district policies about coughing, spitting, sneezing on people deliberately, coming to school if they're still awaiting on a COVID-19 test result. And I've seen, proposed responses to COVID-related behaviors that run the gamut from suspension to assault charges to removal from in-person instruction, online supervised study, to safety contracts. And there really hasn't been a strong voice or a strong set of recommendations. We've not yet seen it at the federal level. I've just said we've not seen a whole lot yet at the state level. To help stem what could be a tide of exclusionary discipline practice. Both taking place, in this new world of remote instruction, but will also look very different as we return to in-person instruction, and it'll happen in ways that won't get captured in the data. No one has been able to, and I don't think we necessarily should have expected this, that anybody could come up with data, a set of questions, a set of variables that could capture just this new range of and these new types of exclusion as they're happening.
Kristen, that is so thought-provoking. As a state agency leader, and we really try very hard, and thanks for sharing that. We did issue guidance around reframing and reopening in school discipline amid COVID-19 to address some of, because I was afraid, that we're going to have all these kids, you take a mask down, all of those kinds of things. And so we really tried to do that. But additionally, and I don't know about other states, but boy, it seems like our families know how to find us. And so I get lots of emails or concerns that come in across the agency when we looked at attendance, and we do have an attendance definition, right, that we put out as a state agency. And, families were calling us and said, okay, cameras on, cameras off. What it did for us was allow the state agency to address those from a policy level, to say to districts, all right, this is what, this is our definition. These are the things that you can't do, and these are the things you can do. And continue, not perfect, but continue to make sure that we stay on top of that, and are continuing to work with one of the things that happened even around attendance, the fact that in school every day, and Ben would know this, sometimes it's the office, secretary, right? That everybody marches by, and that is your attendance in, attendance out. No, what does it look like in a virtual space, right? Is the teacher, right, that you have to rely on? What is your definition? What does that mean? And we're trying to still really maintain a high standard, again, for our kids. And so all that to say that, as state agents, that's the perspective that I bring, that is so critical that we're really thoughtful and intentional and learning from the experiences that we're hearing. I'm always thinking, okay, so what's the policy around that? And it's not just writing a policy, but how do we make sure that folks understand it? And we literally have folks contribute to those policies as well, so it's not just sitting as a bureaucrat and not understanding things on the ground, that we do get feedback. And again, hearing from families as well to help guide that. And so it's, solution mode is like, so how do we do that? And how do we get more of us in that policy decision making body to be thinking about these kinds of things? That it's just heartbroken to think about these things that kids or families are experiencing during this time. And, someone mentioned, I think, just seeing the chat being posted, and some of our educators, like, they're people too, right? They're experiencing loss. They're experiencing, right? They're navigating that, being present for kids while they themselves may be navigating their own losses. So their own social emotional well-being is so critical to that. So how do we think about supporting our entire community? And that's why I said it's beyond one state entity, right? It is beyond, it's talking to my colleagues at the Department of Public Health. It's having them with us every single week, every Tuesday since August 4th, the state epidemiologist on a call with our local leaders and everybody answering questions about what do we do with that child that may be COVID positive? What do we do with everybody else in the classroom? And really setting structures up to make sure that we can have those questions answered and support our entire community. It's so critically important, and a conversation clearly that needs to continue as we go into a new phase of thinking about either folks coming back into buildings or whatever that looks like going forward. Wow, it's so important that we're having these conversations.
Thanks, Charlene. I think that segues really nicely into kind of thinking about the solutions piece, like how do we harness the current moment and just the upheaval that we're experiencing. I think amidst all of that, there have been many calls to really transform so many of the systems that are broken and that desperately need this attention. And so I want to throw this out there just to the group to respond to, but what are, in thinking about the role that law and policy play and kind of redressing harms and addressing so many of the issues that we've talked about today, what are some of those promising policies, whether at the school level, at the state level, or that we need to see nationally to really address these key pressing issues that we've uplifted?
Well, I'll say something happy. How does that sound for the group? So I have the privilege of working with Caesar and Alexis on really what we see as a body of work of both transforming the conversation around school discipline, school policing to an issue of health. And right now, we have actually been looking at what are all the declarations that have been passed and sort of put out within the context of racism as a public health crisis. So for those of you that aren't familiar, the American Public Health Association has been tracking those. They currently have 195 declarations that they list on their website, and someone can drop that into the chat if folks would like to look at it. They're obviously trying to update this in real time. The great thing about working with students is we can update it in real time, because what we found is that separate from that APHA database, there's actually been a few, not many, but a few school boards that have made those declarations. So 5 to be exact, where they have very clearly now thought very specifically about how and where racism is a public health issue as it relates to education, and not just with a laundry list, because most of those 195 declarations just list education as a system that's being impacted by racism, but doesn't actually go in to disaggregate it. So in particular, I can call out a couple. So in the Champaign unit in district number 4, there's now a discipline and equity committee that is working to Ingrid's regular and continued point that I want to echo collaboratively to have an entire revised discipline and safety policy that's protecting, quote, the physical, mental, and social health of students, with an emphasis on culturally responsive and restorative models that prioritize the goal of not having engagement with school policing and the school police department or the larger police department because of the public health issues. And then there's several other districts that have done this, and I don't sort of want to belabor the point, but what we're seeing is there are starting to be these places of intersection that didn't exist before. So if we're going to be, as a country, grappling from, our new CDC director to, city, state, local officials with racism as a public health issue, again, in this moment of twin pandemics, both from a health side and from a social side, then where do schools fit into this? And where does the opportunity exist to really not just think about declaratively calling something out, but now coming up with the scaffolding to start to address that and really kind of taking that step forward. I will say, if there's anyone in this session that is perhaps part of the National PTA or the American Foundation of Teachers, the United Federation of Teachers, or the National Teachers Union, I would urge you to consider your bodies passing a similar declaration, because we know within the public health and mental health spaces that has been consistent from these large entities and these large labor organizations, But that hasn't happened in the context of education. There's been a silence. So I think there's a really great space to look at what best practices are, what language exists, how can we have model declarations that would be available, what might those possibilities be, that we now move from the declarative to actually the operationalization and to build the scaffolding that supports.
That is just awesome. I'm just reacting to you, the Dr. Gonzalez point. One of the things that I wanted to add is something that under the leadership of Commissioner Russell Tucker has taken place in Connecticut and goes back to the point of collaboration is the development of the Connecticut School Discipline Collaborative. And this entity was developed many years ago, and this is the proactive approach. This group of individuals that represent multiple sectors within the state they have a stake in the future of our youth, of our students, of what education does in Connecticut. And this discipline collaborative is basically, it is to advise the State Department of Education on their policies and practices. They engage in courageous discourse. And if I can tell you that one of the first meetings that this group had was about the impact of structural racism on children and how they have that conversation first before they can take a look at any policy. It's about structural racism and the impact on our systems of education, health, and they were having these conversations. So when the pandemic hit, it was like they could not wait to come back together in this virtual space and talk about, okay, now how do we support? What can we do? And is the membership, and Charlene can speak to this a little bit more, it's over 50 individuals that come together to talk about discipline. But they don't talk about discipline. They intentionally talk about the impact of structural racism within discipline. And they provide advice to the State Department of Education. They have legislators in this collaborative. So that's how you engage groups, because they begin to hear, they have educators, administrators, students, and they become engaged in the conversation. So these legislators take this information back as they're making decisions. They're the ones in the legislative body making decisions about what is going to happen, those laws and regulations, which has led in Connecticut to a passing of a couple of bills specifically about talking about how do we structure learning in our state. So I just want to put that as a way in which how do you, as a solution, how do you get those ones who are invested, they really want to have engaged in this level of solutions to be proactive rather than reactive. Somebody asked me the other day, okay, what can we do? Say, think about it before it happens. Because now we are reacting. Think about it before it happens. Know the history, why it happens, and how do you can interrupt it. That's the critical interruption. So I bring that to the space as becoming that aspect of being proactive and not reactive, because we are reactive right now. So, and I know this is very new. COVID-19 is all new for us. But when we have structures in place that we have thought about on a proactive way, we use those structures to be able to develop solutions together because we have already developed this structure. So I just provide that as a way. And I know that we can provide you with the link to the collaborative so that you see exactly who they are and what are some of the goals and objectives, because it is very important to be able to bring individuals at the table to develop solutions together.
You know, Ingrid, thank you for putting that in that space. And I think I was thinking about that when I was, without giving the name of the collaborative, when I said you bring all these people, they're in the tent for the conversations, and they're not easy conversations either. You're familiar with researcher Dr. Darren Graves. Also, we've kind of just incorporated him into our collaborative, and we gave everybody his book, Schooling for Critical Consciousness, and he's in that space, right? That's where, you know, where we talk about this issue openly. And I'll just say anecdotally, but our first meeting, so Ingrid talked about our first meeting, it was like, we're going to go there. We're just going to have this conversation. And, somebody who, a very influential person in her state who folks listen to. And we had this conversation afterwards, and he said, I'm walking away from this a changed person. And it was about, now that you see the impact of the decisions that you make and the consultation that you provide to districts around this. And to me, that I call it my stealth, outcome was about folks being able to say, the decisions you make, Dr. Guns, the decisions you make, there are consequences to those. And that from an individual level, which goes back to where Ingrid started from self, you've got to understand the impact of what it is that you're doing. So it's no longer just, just suspend, just expel, just do that. Technical, you're done. You check the boxes. Let's think about the impact on lives based on what it is that you're doing. And those are the conversations that we're able to have. And like I said, it's not perfect, but boy, it just gives us an opportunity to get all those voices at the table. And that's what's necessary to be able to get to moments of change.
Thank you for uplifting all of those points. And I think especially the piece around the importance of partnerships and collaboration, that's such an important piece of this conversation and in driving towards change. And I know you've mentioned, some of the partners and collaborators of who that might look like, including families and students, as well as legislatures and education leaders. And I wonder who else, especially seeing all of the kind of the diversity of folks who are here with us today, who else needs to be part of this conversation? What is the role of, healthcare institutions and physicians and public health advocates in this work?
Yeah, just to jump in there, I think with COVID, we've probably seen a lot more coordination between education and health than we have in past years. However, it's also shine a spotlight on just how much more needs to happen. And nowhere was this more obvious than where we saw, like, once schools closed, how children with disabilities were just cut off from a range of essential services that they absolutely needed. And while in the midst of that, there was this huge conversation about, well, what does IDEA require in this moment? It was actually a horrific instance where instead of us, trying to figure out, how do we provide, children and their parents, with how do we fill the gap and provide the needs? How do we understand what the need is and rise to meet it? There was this very narrow conversation of, does IDEA require us to act? Does IDEA require us to provide services while schools are closed? And even as we move past that part of the conversation, it became really clear that there is this sort of divide between health and education and how they provide services, even down to the language they use to describe the population. In public health, it's children with special health care needs. In education, it's children with disabilities. In health, it's Title V maternal and child health, dollars. And in education, it's IDEA. And these were not communities. These are not, officials that would often speak to one another. And so trying to figure out, between these two communities and the different connections each would have to different stakeholders, different communities of advocates, different pathways to reach parents. Like, how do you draw the circle large enough and create spaces to have conversation and think about, how do you think about how funding needs to move and shift in ways to actually meet needs that are literally changing by the day and by the week. That need for coordination also extends to education and Medicaid offices. We saw, a bright spot in all of this was how both federal and state Medicaid, officials really flung the doors open as far as they possibly could to provide telehealth services, to young people, and make sure that there were no barriers to using telehealth, in the midst of this pandemic. But now we're coming to a crossroads where, to the extent we saw really amazing things happen when those flexibilities were provided, will those flexibilities continue? And we learned that, while many states had already taken steps prior to the pandemic to expand use of Medicaid for school-based health services broadly, we still have half of states that have barriers in their state policy that really inhibit the use of Medicaid for school-based health services. These are dollars that can be used for school nurses. These are dollars that can be used for school counselors, for other school-based mental health professionals. So, those conversations, still very much need to happen, but, that's coordination that has to be ongoing.
I think it's just folks that have traditionally seen themselves as civil rights advocates should see themselves as health justice advocates. And that really comes down to also what Chris was just saying about the way that we name things, and the way that we construct the language to just descriptively talk about the work that we might individually be doing in our siloed areas, and that it should be more collaborative. There really is no reason, thinking about law schools, for example, that medical legal partnerships aren't focusing on school discipline and aren't thinking about that being a collaborative approach to serving the health needs of young people. But that's really also because the way in which we talk about education as a civil rights issue is about a reactive, remedial issue as opposed to a public health preventative issue. And so again, it's really, how do we, in this new landscape, or in this landscape that has just shifted in a way that perhaps we're paying attention in different ways, invite more people into the conversation so that they see themselves in this. There was a question in the chat just about methodologies and legal epidemiology as one methodology that we could advance this work. I think it would surprise people within the context of public health how scant the research is that actually looks at the discrete individual and population outcomes of school discipline. And then that's even worse for school policing. And that, that's a huge missed opportunity. And that's a gap within the field that we should be thinking about remedying right now. And that we should now have a whole host of people putting their best areas and attention forward to building a body of knowledge that gets translated across a whole host of ways, right? And it's not just about having it live in an academic context. It's when we think about the policy, when we think about the research, when we think about the on-the-ground work, all of that then serves in a different way. But we have to reorient the way we think. Perhaps it goes to Ingrid's point about relationships. We need to see ourselves in relationship as advocates more strongly than we ever have in the past, so that we can start to really move forward and chip away at these drivers, again, in the unique, discrete ways that we might have that expertise, but doing so to complement each other and not feeling that sense of competition or not seeing it as our work living in that way.
Thank you, Talia, and thank you all. I think that is an excellent note to end on, I think, in thinking about the future. And I know that I feel energized and really hopeful from this conversation, and I hope you all do as well. And just, again, my gratitude to all of you, and also to everyone who joined us today virtually. And just before we close, I'll share that we have compiled additional resources and readings for you all that we'll be sending out in an email following this, as well as a link to the recording. After the session, you'll also be directed to a brief survey, and we really welcome your feedback there. And then just finally, I wanted to mention that the 4th episode in this season will dive into planning and the role that planners can play in equitably engaging communities. So I encourage you to check out our website and join our email list, or follow us on social media to learn more about when registration for that opens. So again, thank you so much to everyone today. So grateful and inspired.